Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita, you look more beautiful than ever.
Thank you. And how are you doing today?
What do you think? I'm living it up.
Well, that's two of us, so should we engage our listeners in how to live it up by phoning 866-870-5752 right here in the studio. Talk directly with Dr. Darrow. And just by phoning in today, you get his latest book for free, completely free, no postage, nothing. It is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. So if you're new to the program...
Let me just talk about what those studies are about, Nina.
Oh, good idea.
So the whole point of my medical career has been to save people from orthopedic surgery. I always say this with the show. I love orthopedic surgeons. I just don't like many of the surgeries they do. Some are very necessary, there's no question. If you have a broken bone, something like that, you need to get it fixed. Unfortunately, most of the patients I see have had surgeries that failed. You know, things for meniscal tears in the knees, rotator cuff tears in the shoulder, ankle arthritis, finger arthritis, herniated discs. Why do they fail? Because, in my opinion, they shouldn't have been done in the first place. And there are ways now with what we call regenerative medicine. It used to be called prolotherapy in the old days, meaning to proliferate new tissue growth. And now it's called regenerative medicine. Same idea. And what we do is we inject cells from your body, your platelets and your stem cells, either or together, depending on what you need. And that stimulates the body to rejuvenate itself. Back in the old days, we used concentrated sugar water, which is called prolotherapy. But the newer treatments really are prolotherapy too. It's just we're using more advanced solutions for healing. And it's been amazing on my body as people who know me, listeners, my patients. I've injected both my knees, both my shoulders, both my elbows, my right wrist. I've had to have other people do my neck and back, my broken ribs in the back, because I can't reach back there. Otherwise, I do it myself. And I've been successful all of the time so far, and very excited about this kind of work. I love doing it. It's so much fun to have people come in and say they feel better. What more could a doctor want? Our job really is to make people happy, and that's what my goal is. Every patient has my cell number. That makes them happy, because if they have any issues, questions later on, they can call me up or text me, and they get my email address, so my personal email address. But if you want to get a hold of me now, if you're not a patient, you can go to the website, which is www.lastemcells.com. That's lastemcells.com. And every page on that website has a slot where you can email me. So I get emails all day long from all over the world, and I answer all of them. I start out in the morning when I wake up answering emails. I do them in between patients, and I do them at night. I usually get to sleep about midnight. So I'm very active in my communication with people and my patients, and I love what I do. And Nita, I'm going to stump you right now and get this rolling.
Oh boy, I can't wait.
Are you ready?
I'm ready.
This one's, I saw it this morning and I started laughing so hard. It's so stupid.
Uh-oh.
Okay, Nita, what did Batman say to Robin before they got in the car?
What did Batman say to Robin before they got in the car?
Yeah. Robin, get in the car.
Oh my God! I thought it was going to be something really pithy, and you got to go
Oh,
for the simple on this stuff.
I have hundreds of these waiting.
Oh my God, that's hilarious!
Yeah, patients send them to me, and then they laugh.
That is hilarious.
This one will be easy for someone as bright as you are, Nita.
Oh yeah, don't set me up that way.
What do you call crows who stick together?
Stuck.
Velcros.
Velcro. Oh, that's a good one.
That's
a good. Yeah, I like that one.
Yeah, it's kind of cute. Kind of cute. So I'm going to take a question right now before we get some callers, but I'm going to give out the phone number to the office and to my studio right here, right now, so you can talk to me live. The studio number, write it down, 866-870-5752. That's 866-870-5752. And if you want to catch me at the office or get more information that we don't talk about on the show, the number to the office is 800-300-9300. That's 800-300-9300. And before I take this question, I'm going to mention that besides growing back tissue in the musculoskeletal system, everything really from the back of the head for headaches, neck pain, shoulder pain, low back pain, you name it, hip pain, arthritis all over the place, toe pain, ankle arthritis. I do these all day, every day. I just had a lapse of consciousness, Nita. You must have been sending me very loving thoughts there.
I always am.
Because that's your job, right?
That's right.
The question I have here is that's what I was going to go to. So let me do that first. And this is from one of the emails that I get. This person says, massive tears to rotator cuff. So there's drama in that, the massive, okay? And we all get dramatic about things that are happening to us when they're not really that big a deal sometimes. And unfortunately, or fortunately, whichever way you want to look at it, every day I get patients that come in, new patients, they go, I've got these terrible things. My surgeon said, got to get surgery. I have bone-on-bone arthritis, blah, 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 herniated discs. I'm so nervous. What am I going to do? My friend who got healed by you sent me to you, but I don't believe you can help me. Well, I do an examination. I start laughing, and I go, all these things you've been told are not really true. They're not the pain generator. So I had a woman come in yesterday, terrified about getting surgery on her low back, and herniated disc, facet arthropathy. And by the way, these words that I'm throwing out, go to Google, slip them in there, and then give it a click, and then go to the images spot on Google on the upper left-hand corner, and you can visualize what the anatomy is. So the facets are the joints between the vertebrae. She had some arthritis there, not a big deal. Herniated disc, low back, not a big deal. Why? Because that wasn't where her pain was. Her pain was in the ligaments in her low back and the attachment of her gluteus muscle to the pelvis. Very simple things to heal. Did she also have these other things? She did, but they were not the cause of her pain. So I examined her low back. I said, by the way, did the surgeon touch your body? Nope. They threw up an MRI and scared the heck out of me. You can't diagnose where pain is coming from based on an image. Images are correct, maybe, but they're not the pain generators that they're showing. So you may have all of these different diagnoses, but they may not be the reason you're having pain. So we injected stem cells and platelets in her low back. It was pretty amazing. She got up and she said, I can't believe this. I already feel better. I said, well, there's a little bit of lidocaine or ropivacaine with the stem cells that are less toxic to stem cells that we put in there. And it shows that the solution went to the pain generator. I said, you're probably going to get a little bit stiff later, but It shows that the healing cells went to the area where you're having problems. So this person writes, my husband has two arthroscopic it's arthroscopic. Yeah, people get that mixed up. Had two arthroscopic shoulder surgeries, right shoulder a few years ago. He recently fell and injured his right shoulder. MRI shows massive tears to his rotator cuff. Orthopedic doctor recommends shoulder replacement. He's 81 years old, does not want a surgery. Well, that's kind of good news that he doesn't want the surgery because he probably doesn't need it. And this word massive tears to the rotator cuff doesn't mean a whole heck of a lot. So I haven't met this person yet, but I am going to bet they do not need a surgery and that we can help them using platelets and stem cells. Okay, very simple. You walk in, you get your blood drawn, or you get your bone marrow taken, you get injected, and you walk out. Okay, people say, do I have to drive with a friend? Do they have to drive me home? Nope. Will I be able to walk that night? Yep. It's just a pretty non-invasive thing to get these regenerative medicine treatments. So I can't help everybody. There are situations. I had a gentleman come in last night. He was about 81 years old also, and he had almost fused hips. He said when he grew up in Alabama, they lived on a farm, and he used to jump off the roof of a 2-story barn. He used to do it all day. It was so much fun. And he pretty much destroyed his hips. The joints were just worn out. Doesn't have much range of motion. He walks with a walker. And he said, can you help me? I said, I can probably help you get rid of some of the pain by growing some cartilage back. But unless you were to do a lot of treatments, I probably cannot help you get back your range of motion. So a lot of people would choose to do the treatment based on that. A lot of people would choose not to do the treatment based on that. The age of 81 is not a great age to start getting a major surgery because the body doesn't heal very well, and there's other comorbidities typically by that age. You know, it could be hypertension, diabetes, or things like that, and people with those do not heal as well. And these are not easy surgeries to go through. When I had a shoulder surgery while I was in medical school, it did not heal up. It didn't heal up at all. It got worse. Okay? I was lucky enough to have discovered regenerative medicine, and I injected my own shoulder. It was healed the very next day after a bad surgery. It was pretty miraculous. I always think of it as God kissing me on the forehead saying, go forth and do regenerative medicine. Get away from thinking about surgeries. And it's been a great life for me. It's been a great life for most of my patients. And I'm always excited to get into the office and do this work. People go, how come you don't take vacations? And I go, well, I do once in a while because my wife likes to travel, but I really don't. I like being in the office and watching people heal. It's a great life. So at any rate, I'm going to take one question.
Do you want to give the phone number?
I would love it. I'd love to hear from you right now. The phone number to the studio is 866-870-5752. If you call me right now, I'm going to give you a copy of my book, Stem Cell and Platelet Therapy. It's got something like 264 studies on why surgery is not a great thing in orthopedics. And there's cases where it is needed, but most of the cases that I see, it never should have been done, and it failed. I see way too many failed surgeries. Sometimes it doesn't fail right away. Sometimes it does, but sometimes down the road it fails. So these studies are all about how regenerative medicine works and how surgery can fail. So don't go jumping into a surgery thinking it's a panacea for your pain. It just isn't like that. And I was trained in orthopedic surgery, and I'm not doing it. And you can guess why. My shoulder surgery turned me off to it. So this person says, how do you determine if a patient is a good candidate for stem cell plasma? I've been through physical therapy, but it is no longer working. I'm feeling a lot of pain in my knees. So the most important thing is doing an examination, and I can check the integrity of the knees. I can see if there's a lot of grinding, which we call crepitus. I can see if the knee is loose. Can I tell those things from an MRI or an X-ray? Nope. And I get a lot of people that come in with X-rays and MRIs showing arthritis, and it is not even the cause of their pain. So the examination must be done. Big key, the walk-away lesson from this show right now today is if you have pain in your body and you go to a doctor, make him examine you. Most doctors don't do an examination. For some silly reason, they rely on the images, which are false. So, Nita, I'm going to go to Terry in Alhambra.
All right.
Terry, you have degenerative discs in your neck or back. Which is it?
It seems to be in the back. I've lost about 3 inches in height.
Okay, and how old are you?
I'm 76.
Okay. And most people, by the way, lose inches in height as they get older. And the reason, or one of the reasons, is that the discs become desiccated or dried out and they lose their integrity. Okay, that's DDD, degenerative disc disease. Okay? So that's not uncommon. It's very, very common. The other thing is, as we age, after sitting at a desk for endless years, we're bent over a little bit. We get what's called a kyphosis in our upper back.
Oh.
So I don't know if you have that, but the other reason for it is that the bones become osteoporotic. That's not arthritis. It's just that they demineralize. And then you see, the dowager's hump, and the vertebrae doesn't line up correctly anymore.
Well, I don't have a dowager's hump.
Okay. Well, I haven't examined you, so I don't know what's going on. You may
Right.
be. Most people are leaned forward; their shoulders come forward a little bit, and that's a loss of height too. So I need to examine you, touch the areas where you're sore, and then see if there's something we can do for you. Your pain is probably not from degenerative disc disease.
Well, excuse me, doctor, but I don't have any pain at all.
Oh, you're just curious about why you're shrinking? Okay. We could do a bone density. That's an exam where you lay on a table and sort of an X-ray wand goes over your body quickly, and you find out how your bones are. At the age of 76, if you're not on hormones, bioidentical hormones, then your bones are very demineralized, and there's probably a 95% chance that you have osteoporosis. Okay? And with that, the bones demineralizing can become misshapen, and you get these deformities in them. So you're lucky. Yeah. So you were calling really just because you've lost height. Interesting.
Yes, I'd like to get it back.
That ain't going to happen, honey, unless you do some exercises to be stretching your spine back into the proper shape.
Okay.
But I can't even tell you that'll work for sure unless I examine you. Okay?
Right.
And don't get caught taking biphosphonates. Those are medicines that regrow the bones, supposedly. They do not do that.
Oh.
They actually cause fractures.
Oh, my.
Yep, Actonel is one of them. I'm blocking the name of the most popular one because I never give it to people. And it can also cause terrible things in the esophagus. So don't take those medicines. If your doctor says to do it, do it. He says if you want to. I'm not your doctor until I examine you and you come in the office, get a history. So this is just general information, educational information. And Anita, do you know what that medicine is? You're pretty smart.
Oh, the statins?
No, those are even worse because they affect, the statins affect your neurological system and your musculoskeletal system. That's for people that supposedly have high cholesterol when they don't even have high cholesterol. I don't want to get into that one now. But at any rate, if you want to grow back the density in your bones, the way to do it is with bioidentical hormones. They start the bones remodeling again. So, Terry, as you went through menopause, you lost your hormones. Okay, that's just what happens. Men lose them too. With women, it's called menopause. With men, it's called andropause.
I see.
So men get the same thing women do, but for some reason doctors don't think about men because men have bigger bones to start with. But men end up with osteoporosis the same way that women do. Anyway, I'd have to examine you. If you want to come in the office, the phone number to the office is 800-300-9300. That's 800-300-9300.
Okay.
And by the way, there's one more thing. These biphosphonate medicines that people take to regrow bone do not regrow bone. What they do is they block the cells that are called osteoclasts from working. Those are cells that get rid of old bone. So you're left with...
They actually block the cells from performing the way they should.
That's right. So the osteoclasts remove old bone, and then the osteoblasts put in new bone. So you have healthy, spry bones. When you take these medicines, that process is blocked. So you look at a bone density, and it looks very good because the bone looks good. But it's terrible bone. People that take these medicines get jaw fractures and femur fractures because the bone looks good, but it's terrible. It's old, fragile bone.
I see.
Don't take them.
They still use them, even though they know that they're dysfunctional.
Honey, do you know who motivates the medical system?
No.
Drug companies.
Okay.
Yeah, that's where all the money is made.
Well, I understand that, but I mean, you'd think that when they find out that they're not functioning the way they should, then they would recall them and do something else.
You would think that, and you would think a lot of things about medicine, and it's not done because it's the culture of medicine, and doctors are terrified to go against the wave. Doctors get most of their referrals from patients and from other doctors, right? But mostly from other doctors. And the other doctors have to stay in the system too. If you go outside the box, you're not going to get a referral from another doctor. There goes your business. See, my referrals come from patients, not from doctors.
Right.
I do get some, now that I've been doing this for like 25 years, I am getting referrals from MDs, a lot from DOs and chiropractors, because they know my work. I've been around a long time. But most of my patients come from referrals from patients who got better.
Well, you mentioned exercises to regenerate the discs. Now, is that something that you give out a set of exercises, or how does that work?
I didn't really say exactly that. You could get physical therapy to get better posture, which you could do at home without a physical therapist. You can look that up on Google. It's just extension exercises. You go into a doorway with your arms out and put your head back and put your hips forward. Because you're probably, although you haven't said anything about it, you're probably osteoporotic and you're probably a little bit hunched over. So if you want to get height back, you got to straighten out your spine. You know where I do it? I do it every day in the elevator, coming down from the parking to my office, and then coming from my office and the elevator back home. I've been doing those stretches for years and years and years. I have something I bought on Amazon that's a little rubber thing that goes on the floor. I lay on that so it stretches my shoulders out. There's a lot of things that could be done. Okay?
Well, your final, the bottom line is and this is a question, is it possible to regenerate the discs and regain height, or is that something that is beyond the realm of possibility?
No, it is possible. There are studies that show that if you do regenerative medicine on the spine, some of the disc space can come back.
I see.
But I don't treat people for that. Terry, it's been great talking to you. We're going to go to the break. And if you guys want to call in and talk to me live, the phone number is 866-870-5752. If you want to go to the website at the break, it's www.lastemcells.com. And the office number, if you want to call there now, is 800-300-9300. Nita, thank you.
Well, thank you.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.